Hey everybody, Colin Mackay, a third-year internal medicine resident at the Ascension St. Evansville internal medicine residency, and just wanted to film a quick video highlighting our inpatient resources. So I'm here now in the parking garage. I'm just gonna walk in. So this is coming from the parking garage, and then on my left here we have the emergency department, and that's the parking garage or parking deck, however your preference is. And it is just a beautiful morning here in Evansville. Okay, so next up, just a quick look at our ICU services here. Coming up on our charge nurse office, and Lauren is in there hard at work. She covers both the charge nurse role as well as the emergency RN role, and I'll just kind of get her to tell you a little bit more about that.
Hi, my name's Lauren. I am one of the clinical supervisors for critical care. On day shifts, you may also see Josh. He's my counterpart in this. So we are in charge of the medical ICU, which is a 24-bed ICU that prioritizes in a variety of patients, anywhere from sepsis to post-code, respiratory failure, and ARDS. We also cover the surgical trauma ICU, as well as the cardiovascular ICU. Both units are 8-bed units. Our STICU prioritizes obviously in trauma and 911 recovery, as well as post-surgical population. And then our cardiovascular ICU prioritizes in open heart recovery. You may see the surgeons in there as well. Currently, we also cover the ERN role, which helps respond to RRTs and codes throughout the house.
Awesome. And here we have one of our typical ICU rooms, spacious for central lines, and a lot of room beside the bed as well for A lines, sinusites, ultrasounds, etc. So that's a brief run on our ICU. Thank you, Lauren. Appreciate it. Okay, so next up, just showing you guys an idea of what we have from resources in the emergency department standpoint. So just coming in near the upper rooms here. Okay, we have a well-staffed emergency department. This side this morning is in a good spot from a busyness standpoint. I'm not going to say the Q word, but if you've seen one emergency department, you've seen them all. Pretty well put together. We have our workstations here where we'll be able to do quick orders, pre-charting if we're seeing any new patients. Coming down to the main section of the emergency department. First, we have another workroom up here on the left with a few more computers, dragons, dictation systems, where we're able to access the EMR quickly. And then over here would be a good view of what a standard emergency department room looks like. Space, tele, computers in the rooms, and then nursing station here. And then it does continue to wrap around, but for the sake of patient privacy, I can do the full tour now. It's just a little bit of a better view of the workstation, phone, computer, dictation. Hey again. So next, just coming up the staircase here to one of our med-surg floors and rooms. We have a room, great bed, telemetry, bathrooms. The fourth floor as a whole functions both as our ICU step down as well as portions are med surg as well. Okay, so next up we have our resident work area. So it's 3 North, which is a retired unit of the hospital that we have both our workrooms as well as our chief office, our Troy Manz Memorial Lounge, as well as where we get our food at lunchtime. So just first up, we have to our right here, the morning report room. So this is where we do inpatient morning report. Same thing as in the outpatient clinic, about half an hour just before the day starts of patient-centered teaching. It's also doubles as our noon conference space where we go over our board review curriculum as put together by faculty that have extensive experience in developing board prep resources. So two big parts of our academic day, and again, just a really nice room to sit, learn, and enjoy each other's company. All right, so coming back out to the main 3 North area. So there are a few lockers here on our right, which is where we just kind of get our stuff, leave it where we need for the day, and then 2 workrooms for the wards teams, workroom 1 and workroom 2. So both have enough workstations for a full resident team, as well as 2 whiteboards to go over track patient information, as well as even some focused teaching if we need to, and both also have their own fully functioning restrooms, as well as TVs if needed to review imaging as a team. Here, and we have the Troy Manz Memorial Lounge. This is a good place to relax after we've done the work for the day, or if we just need a place in the hospital to just take a minute and reset. It has a TV. We have our own coffee machine. Also, some residents have brought in some video gaming consoles to use on particularly kind and quiet days, as well as we have our own fridge. And then at the end here, we have our prayer room with rugs for those of our colleagues who are Muslim. And I would like to take that moment throughout the day to pray. And then some extra restrooms. And then up on our left here, classroom 1 and classroom 2, which are the places that we take for specific, again, patient-focused teaching time, massive whiteboards, big TV to help review imaging. And this is in that time just after we finished our teaching rounds, and we come back just before kind of getting into the usual workflow of the day, taking some time to go over a specific topic to improve our comprehension in that area. And then this is a specific women's restroom. The others are non-gender specific, but a women's restroom in classroom 1. And then here's our kitchen, which is where they bring the food for lunch. Hold things in nut-free zone. We also have some good snacks. We have some fridges. Sometimes we're able to stack this with some tasty freezies and other treats, as well as the coffee machine is something that we will have going as well. And then here we have the charge nurse station, which is where a lot of our residents who are on subspecialty rotations will sit and do their work, as well as that initial little alcove that you saw when you walked in here. To my right now. So these are the 2 spots where physicians that are not on the inpatient wards teams can sit down and do their work. And that's 3 North.